All right, we're just going to take a few more from the back. Okay.
Okay, thank you. Dr. Jah, can you clarify your recommendation to the First Lady? Obviously, the White House is a big place, 132 room, 35 bathroom. So the president has a big place to isolate. Is he going to, will you recommend that he isolate from the First Lady? Will that be your recommendation?
Like, you're just trying to get me into trouble, aren't you, in terms of... No, I think he should isolate. And that he should follow CDC guidelines. He should isolate. He is isolating. He is isolating. I think the First Lady is, because she, I think she's wearing, she's tested negative. She's been wearing a mask. I have to say, I have not engaged on the question of what happens when the First Lady returns back. I don't know if you have anything else.
I have a follow-up. And then on masks, the president wears a mask, he's well protected, but he still got COVID. Is this the time to really realize that masks may not really be as effective as, we try to make them to be?
So I think the science on masks is actually quite clear, and there is broad agreement among public health and science experts that masks work. Higher quality masks work better than lower quality masks. He wears, every time the president wears masks, he wears high quality masks. Masks are not a panacea, and obviously the president, engages with people both indoors and outdoors, and there was never, I think, an understanding on our part that we could keep the president from having zero chance of getting infected. Like, he's got very close, very strong protocols around him, but we always knew that this was a possibility.
Go ahead, sir.
Two questions that I think haven't been asked yet. First of all, given that the president now has tested positive for COVID, will there be a reevaluation of the protocols that were put in place at the White House to protect him from getting COVID in light of his condition being in a different place? And the second question is, for folks out there who may now hear from their employer, well, the President of the United States got COVID and he kept working, when someone thinks they need to take a sick day because they got COVID. How would you answer that, or how would you address that question?
Well, I believe people, if they feel ill, should absolutely get sick time to recover. The president feels well and feels capable of continuing to work. Obviously, his schedule is modified, right? He's not going to be able to make the same trips, but he's able to work from home. But I feel very, very strongly that if people feel ill, people feel sick, they absolutely should get time to recover. That's something. So that's your second question. What was your first one?
The question was the COVID protocols,
the
the
COVID
testing
protocols
for being in the same room as the president and the like, that were designed to, now that his risk situation has changed when he recovers, will there be a reevaluation of the protocols at the White House?
Yeah, right now I'd say we're focused on making sure the president continues to do well. He is thankfully doing well because of the fact that he is vaccinated, boosted, getting treated. I don't think there's been any discussion of whether the protocols need any kind of change.
All right, two more and then we're going to go.